Thank you for the very warm welcome. And as my slideshow says, I am hoping that by the end of this, we're ready to get energized and get going. So I wanted to start with a story. This is a picture of my husband. In October 30th of 2010, he was diagnosed with stage 4 non-Hodgkin's lymphoma. So I had already been a cancer researcher, a cancer prevention researcher for quite a number of years when he had his diagnosis. But he had a very rare type of non-Hodgkin's lymphoma. It was called mantle cell. And maybe some of you have heard of it, but about 2% of all non-Hodgkin's lymphomas are mantle cell. So I didn't know what the prognosis and what was going to be happening. So it was quite a shock and kind of changed my trajectory to start thinking more about cancer treatment and side effects. And I want to say that, for about 10 years before his diagnosis, he was actually having anemia. And it was an unusual type of anemia. And throughout that, it was sleep and fatigue that had brought him in to see his provider, right? And then afterwards, after his diagnosis, it had actually spread into his GI system. So we went through a nice long year, which probably sounds very familiar to many of you, that included surgery on his GI tract, a whole round, many weeks, of course, of chemotherapy, and then around a month in the hospital for a bone marrow transplant, where, of course, your sleep gets disrupted no matter what you try to do. Throughout that entire time, from all the way when he was diagnosed with his anemia, down to the very last days of his bone marrow transplant, and now into his survivorship, which has been 6+ years, not one of his providers ever asked him, was he fatigued? So it was a very insightful set of years and time for us. And right now, that is his number one complaint. He says, I'm still, very active. I exercise, I garden, walk the dogs, that's one of them there. And yet, he still is plagued by issues with fatigue. So, okay, he's fatigued. He doesn't like it, but is it really important? Are there more issues than him just not liking it? So I'm going to start off with a definition of cancer-related fatigue, because I talk to a lot of oncologists. We go and we talk about fatigue, and the oncologists always stop me and say, wait a second, okay, I'm fatigued. That's what the oncology providers tell me. They say, can we? Yes, exactly. Can you help me? And I say, well, let me just tell you, if this is the fatigue at the end of your day, seeing patients, running to different meetings, and then not going to bed on time, I can't help you. I said, go to bed. Have better, work-life balance, if at all possible. I said, this is not what we're talking about with cancer-related fatigue, okay? What we're talking about is something that here, as this slide tells you, it just is not something that is available to you when you wake up, even from a good night's sleep. It doesn't feel that way. It's not good quality. It's also a whole body experience that makes you feel like, you're just weighed down, and that no matter what you do, you're not going to be feeling more energized. And it's also something that is on top of normal tired. So this isn't something that, you're just feeling at the end of the day, although it may be worse. It's something that you feel on top of stress, on top of mood disorders, on top of, just daily life activities. So it's more than just that. So fatigue is also very, very common. As you can see there, this is averaged across all different types of cancer. And we have not yet found a cancer that this is not true about, from pediatric cancers all the way on up. And as you can see there, almost half of all undergoing treatment, some obviously far more than others, and about 1/3 of cancer survivors. And for those cancer survivors, we're talking many years later, when we take a look, about 1/4 to 1/3 are suffering from significant fatigue. So we're not talking a little bit. This is moderate to severe fatigue that's impacting their day-to-day life. It also, as I pointed out with my story, it's impacting all different types of quality of life issues, and your friends and family, by the way, too. I can speak from experience there. And when you really talk to cancer survivors, both individually as a clinician, as a researcher, and when you look in the research literature, pretty consistently, it tends to be, if not the number one symptom that causes problems, at least one of the top symptoms. An area that's kind of emerging, but people do not talk about, is that people who have more fatigue and more severe fatigue have a shorter survival, shorter time to reoccurrence, and it may be an independent prognostic factor for how bad that cancer is going to be. That's even when you take into account, say, blood test or imaging. And so I just wanted to show you, like, this isn't all, but to give you an idea of the different cancers we've seen this in. So breast cancer survivors, you see that. Gliomas, esophageal cancers, prostate cancers, myoplastics, and metastatic colon cancer. And this is not the entire list. So clearly, fatigue is a signal that is important. So do oncology providers ask about fatigue? I'm looking around. Some do, to acknowledge it, and some don't. There's very little research into this area. They've just asked some people, some physicians throughout Australia, about a third to 40% would ask their patients who were experiencing fatigue if they had it at all. And about half of those were then offered a treatment. Now, in all fairness, when I talk to a lot of oncology providers, they tell me, well, if a person isn't anemic, if they aren't hypothyroid, if we're doing everything we think we can do, I just don't ask because I don't have anything to offer them really, realistically, that I know anything about. So I don't ask it, and I don't know. And I have had some oncology providers who have actually told me that, you know, I don't really think it's real outside of just normal tiredness. So there's a long ways to go to really develop an awareness amongst us and our providers about fatigue. So do we have good treatments for fatigue that are evidence-based, shown to work? The answer is yes. We have exercise, which I know you talk about a lot here. It's fabulous. Both aerobic and anaerobic exercise is great. We also have counseling. Both of them are great. But what's the number one barrier to both starting and maintaining exercise? Fatigue. Yes, it's kind of a catch-22. And at least in the States, we have very few people who are trained to be providers. We also have stigma issues that still maintain. And in the States as well, we have lack of insurance coverage, making it very challenging to be able to provide enough services for counseling. So both of these things cause barriers. And so it makes a lot of sense to look at issues for self-care that we can use to empower and help ourselves. So I'm going to go in a little bit different direction just for a few seconds about what causes fatigue. You could see many different causes. Because when I talk about these different treatments that we've looked at, I want you to have some ideas why we chose them and what we've been doing to kind of think about what causes fatigue. Because right now, we don't know. That's the real issue. So a little bit of science to wake us up here on a Monday morning. This is a model called the Cytokine-Induced Sickness Behavior Model. It's quite a mouthful. Cytokines, for those of you who don't know, are chemicals that circulate throughout the blood and the tissues that are inflammatory or anti-inflammatory. They're very important for infections and fighting other diseases. You want them to go up acutely for sure, and then go back down, and they're part of your immune system. You don't want them to stay up and elevated for long periods of time. But what this model says, and we know this is true in rats, but we're not rats. We don't yet know if it's true in people, is that when you have an assault from something like tumor biology or radiation or chemotherapy, inflammation goes up in the body, these cytokines go up, okay? Then they're circulating and they can cross the blood-brain barrier and actually cause a cascade of inflammation in your brain, okay? And that change causes changes in your neurotransmitters or your neurochemicals in your brain, and that's what causes behavior, okay? And what it does is it actually increases fatigue, it decreases hunger, It increases depression, the desire to be alone. And you have to say, why would our body do that? Okay? Well, there's a really good answer to that. If you have an acute infection, you don't want to be around other people to infect them, right? You don't want to be running around trying to find food for yourself, right? You should be resting. And so your body created all these things, including aches and pains, to be able to keep you as isolated and relaxed as possible, okay? This is great, then you get better and these go down and your behavior returns. But in the Cygnus model, it kind of says, no, these stay elevated and you have long-term behavior changes and symptoms such as fatigue, chronic pain, and sleep disruption. So this is the most prominent model. It's not the only model out there. So my colleague and I, Dr. Richard Harris, who's a neuroscientist, he looks at brains using things like magnetic resonance imaging, where you can actually see blood flows and oxygen signals in the brain. And we looked at breast cancer survivors who were fatigued, and we compared them to breast cancer survivors who are not fatigued, who are the same age, by the way, because your brain, as it ages, as we all know, it changes. And what we wanted to do is we wanted to actually look at several different areas of the brain, and I'll say that we ended up looking at this area called the insula, which is where, I'll say this red dot arrow is pointing. So the insula is an area of the brain that's very interesting. It's just in primates, by the way. In higher primates, it gets bigger. And that's an area that allows us to feel the world around us, to take emotional and physical cues and translate them, okay? So it's actually been seen as maybe a seat of consciousness. Kind of cool, yes? And so when levels of neurotransmitters, like we've looked at here, change, behavior changes in association with our sensation and how we interpret the world around us. So what we found in the insula is that those who are fatigued, which are all the people on the right-hand side versus not fatigued, and so that line there, by the way, is the average, and then those individual dots are individual people, okay? And the higher those dots, the more they had of that chemical. So the higher they had of glutamate, which is an excitatory neurotransmitter, when that's high, by the way, you have too much, really bad things can happen, like seizures. So you don't want that. If it's just kind of high, we know it's related to the chronic pain. And now we found that it was related to chronic fatigue as well. We also found that creatine, to total creatine, this is involved in energy production in the brain, for ATP, for those of you, so the main driver, that actually those who were fatigued ended up not having enough of this free creatine to make energy. And then also, not surprisingly, we had more inflammation circulating in the fatigued people with one of these cytokines. Then we asked ourselves, well, of course, if this model was correct, these things should be related to each other. In other words, when it goes up high, it should also, these other things should be high in the brain. But what we found out is no, they're different from each other, that they aren't related to each other, at least in survivors at this point, and that these were each different ways people were fatigued, showing that it's probably much more complex than that sickness behavior model, that there may be individual groups that have different causes, and that we need to think about different ways to identify them and to treat them. It makes a lot of sense. We're often not exactly the same. So thinking about this and thinking about treatments for these individual people, I want to transition us over to acupressure. So I'm guessing that a lot of you here already know what acupuncture is and may even know what acupressure is. But for those of you who may not know kind of the one-to-one relationship, acupressure is using the exact same points that people use in acupressure to stimulate them. Instead of with the needles, you stimulate them with your thumb, your finger, or a device. And I'll talk a little bit more about devices a little bit later, but a lot of people in our study, just to let you know, used pencil erasers. They said they're great, by the way. So that can be very low tech. Obviously, thumbs and fingers can as well. And so we just have a person stimulate it instead of turning the needle the way an acupuncturist might for you. You actually use your thumb or finger in circles, either clockwise or counterclockwise, with pressure to stimulate that point. Okay? So why acupressure? So first, bringing it back to what I told you about the brain and different types, we already knew from acupuncture and from some imaging in the brain that we've done with acupressure that it actually lowers those levels of glutamate and creatine. So it's already working on some of those exact things that may be the cause of fatigue in our group. We also knew that acupuncture looked really good for helping to treat fatigue, but you had to come in for 6 to 8 weeks, at least twice a week, to get treatments. Now that can be hard on people, right? You have to travel long distances possibly, or you have to take time out of your busy schedule to be able to do that. And so we wanted a more self-care. We also had found from the study that people who were 65 and older were not as good responders to acupuncture, but we thought if we could give a higher dose, something we don't often think about with this, so more of with acupressure so that you could do it on a daily basis, then maybe we could help more people. So all those things came into play. And just to let you know, we don't have very many acupuncture providers in Michigan where I'm from. We have 11 million people. We have 99 licensed acupuncture professionals in our state. So even if we wanted to do everything for free and everybody had the time, we needed self-care options. So this is the study design that we did, just to orient you. So I hope you guys, if you can't see it, you can hear me, that's fine. So what we did is this was after a series of studies. These were all in breast cancer survivors who are apparently cancer-free, so stage 0 to 3, and they had been done with their cancer treatments for at least a year. So their diagnosis was at least 2 years ago, but on average, they were 5 to 6 years after their diagnosis, okay? These were people who had chronic fatigue that was moderate to severe, that we measured with something that I'll talk about a little bit later called the Brief Fatigue Inventory. And they couldn't be on active treatment at all except for hormone treatment, which some of them were, although not a lot of them. And we put 288 of them on study. We randomized them, and we put them into one of 3 groups. One of those groups was usual care. By the way, everybody got usual care, and what we meant by that is whatever their healthcare provider had told them to do for fatigue, we collected that. And to their credit, yes, some of them had been told exercise, do yoga, sleep better, have better sleep hygiene, but many, many, many had been told nothing, so it was variable. The other 2 groups were told to do one of 2 types of acupressure. These acupressure treatments, which I'll tell you about what the points were in a little bit, were distinct from each other. They had different sets of points, and then we named them. Just to let you know, we came up with the names. They're based a little bit about their uses in traditional Chinese medicine. One set of points were called relaxing, which comes more out of the tradition of insomnia, treating insomnia, and stimulating. Long story short, we thought was going to be the active treatment a long time ago, but we no longer thought that when we did the study. Were actually points used traditionally for fatigue. And so we just came up with these names, but all they are acupressure points. We had people do the acupressure once a day for 30 minutes per day on average is how long it took for 6 weeks. And then we said, stop. We want to see if it continues to make you not feel fatigued when you don't do them for the next 4 weeks. Okay? And then we assess them at baseline and then at 6 weeks and at the end of that 4 weeks. So how did we measure these things? I get asked this about a lot of when I talk to cancer survivors. They're like, well, how do you tell if someone's fatigued, right? I mean, they can say they're fatigued and how fatigued they are. So we use what are called patient-reported outcomes. These are pen and paper measures that have been actually validated. And the fatigue measure that we use there, you can see, is the Brief Fatigue Inventory. That was made at MD Anderson Cancer Center in Houston. And you can see what we do there is we have an average of measures that are interference and severity of fatigue, and it goes from 0 to 10. At 4, you're considered moderately fatigued and above, and at 6, you're severely fatigued. So keep that in mind when we talk about this. Yep. 0 would be like no fatigue, 10 would be like the worst fatigue you've ever experienced. Give you an idea. Then we also looked at sleep quality with the Pittsburgh Sleep Quality Index, or the PSQI. This is a very commonly used scale for sleep quality. And in this case, if you're higher, you're worse. You have worse sleep quality. At a 5 cutoff, you're considered a poor sleeper. You can see it goes quite a bit higher than that. That doesn't mean you have insomnia. It just means you have poor sleep quality. And it's used for a lot of insomnia studies as well for the quality part. And the last was a quality of life, because that's, of course, very important overall. This is a long-term quality of life. This was actually made for female breast cancer survivors. So you'll see a lot of other quality of life tools. They are often made in people who are in active treatment, which is a little bit different than survivors. We had 4 subscales there. You always have these complicated things, but quality of life is complicated. And you had one about somatic concerns, so about how you assess your body. Fitness, it's exactly what you think, how fit you're feeling and acting. You had spiritual, and you also had social interactions. Okay? So here are our points. So this is overlaid on someone so you can kind of see the anatomy if you're into that sort of thing. And what you'll see there is that we have red dots, which are the relaxing dots, and we have black dots, which are the stimulating dots. And definitely, we share these points. These are actual, both of them are real acupressure points. They're not made up or faked ones. And as we said, we had everybody stimulate each one for 3 minutes each, okay? So it's a decent amount of time. We said don't break up your time while you're doing a point. You can take breaks in between. Start at your head, go to your toes, go from the right to the left. That's nothing scientific about that. That was just so people could remember all their points, all right? And as we said, we had them do it once a day. We asked that people do it at the same time of day, but we did not dictate that you must do it in the morning, or you must do it in the evening, or you must do it at lunchtime. People kind of decided what they wanted to do. And we actually taught people how to do this. It takes about 15 minutes total to be able to train them one-on-one. And we had our research assistants and or nurses who'd been trained by an acupuncturist train them. And we actually measured how well they did that and how well the women actually did at stimulating these points, both of which they did brilliantly on, by the way. So they're very good at it. So what did we find out? So basically here, you'll see this is our brief fatigue inventory. What you'll see, the bottom is the weeks. So you say 0 through 10. The first 6 weeks is when they were doing it. The 4 was when they weren't. And that gray area underneath represents the 4 and below, so that's when they hit normal levels of fatigue, okay? So the line that looks like it's going flat across the top was usual care. So over the course of the study, they pretty much stayed the same, which is kind of what you expect in these studies, by the way. The other one, the yellow line there and the blue line, right, were the 2 acupressure arms, and what you see is both of them got significantly better over the course, and they stayed pretty stable over the 4 weeks of the washout when they weren't doing it. There was no difference between the 2 acupressure arms, although you can see relaxing is going down a little bit more than stimulating. But that represents about 2/3 of the women actually achieved normal fatigue and stayed there over the course of the study, and only about 1/3 of the women in usual care did. However, there was difference in sleep quality between the relaxing and the stimulating acupressure, all right? So that Pittsburgh Sleep Quality Index, the relaxing significantly improved it, stimulating not as much. Also for quality of life, 2 of the subscales, what you'll see is fitness and somatic, of the quality of life subscale, so how you experience your body and how fit you feel and want to do exercise, improved significantly in the relaxing arm compared to usual care, but that did not happen with stimulating. So in summation, it really was that for fatigue, both of them did equally well, the stimulating, the relaxing, but the relaxing did better for sleep quality and for quality of life. So we really wanted to say, how do you bring this to the community? How do people who can't travel to get this actually be able to learn and do this? So we decided that we wanted to actually make an app. And we actually did this with the help of focus groups from breast cancer survivors. So you may not know this, there's lots of apps that you can put on your phone or your pads, your iPads, that are made for various health reasons. Almost 0 of them are actually made with the group that actually uses them, that are the end users. In this case, it would be you. But we decided we wanted to make it. And so these women were involved from the name, on through. So they came up with this. This is called Me Time. You'd open it up and you'd see this as the opening page. And then you'd get a nice picture of where the various points are, for instance. And you can then tap on one of those points. That person looks familiar, I know. Myself and my co-investigator, we were free actors, and so we got drafted. And so you can actually see us, and we're doing the points and showing you that. And you can also then tap, and we have illustrations with directions on how to do the various points there as well. So you can always go back and have this. But one thing that was entirely surprising to us that the amazing cancer survivors told us is it's really important that you do enough pressure. It's the #1 most difficult thing. People don't do enough. And they're right. I mean, it is true. And so you need an objective way to be able to tell people using the app. And they told us what we want is a device that would be able to help us. So they came up with the AccuWand. Yes. And so this is a concept we're working with engineers where it actually will be able to tell people how much pressure they have. That'll actually tell them when they have either too much or too little. They can individualize it because we all know we have different levels of sensitivity to pain and pressure, if need be. And then they can use it to actually stimulate a particular point as shown there. And that's based on that large pencil eraser that they told us. So we're working to put that together, and it'll have a nice little timer light on there so that when 3 minutes is up, you'll know, etc. So you can use this with the app, and once you learn the points, you can use it just with the wand. So another thing I really believe in is choice. And so not everybody likes acupressure or is going to be able to do acupressure for whatever reason. So we also looked at diet, something that we could use with the app or something that you could use individually, or obviously with exercise or counseling, all these things together. And just to let you know, we already know some people are using some of these at clinics and giving them to people like menus and saying, which one would you like to use for your fatigue? So we had some preliminary data showing what type of foods and nutrients actually were associated with lower levels of fatigue or not having fatigue in cancer survivors. We also knew from the literature that a lot of people had looked at very grossly, like if you're a cancer survivor and you eat more servings of fruits and vegetables, which by the way is a very rough way to measure it, that's basically how they would ask it. Did you eat more vegetables? Yes. No. That's kind of what we had level of data. And we knew that even when they said gross things like that, those people had less fatigue. But we also know that people who tend to say they eat better and do eat better do things like exercise more, right? And they tend to have lower weight because of that. And those things also help, we know, with fatigue. So we didn't know. Does diet actually improve fatigue, diet quality in particular? We didn't know. So we decided to do a pilot study. And so going back, remember that cytokine-induced sickness behavior? If you don't, I don't blame you. It was a while ago. But here we are with the brain just kind of showing you where we think diet impacts this. So we think if you have an antioxidant-rich diet and one that's really rich in omega-3 fatty acids, which probably a number of you have heard of or even take, like fish oil, flax oil, very high in omega-3s, that those are anti-inflammatory and might help to shift that brain chemistry we talked about. And so that was kind of our thought. So familiar kind of flow here again to let you know what we did with the study. So in this case, we had 30 women, pilot, so small number, and we had 15 of them go into the fatigue reduction diet, which I'll tell you what that is in a minute, and 15 of them into the general health curriculum, which is something that we call attention control. So that means it was matched for the same amount of time and visits and lovely attention that you would get from our study staff, who are very nice to all of you, right? And love to chat with you. And that's important because we thought, if someone chats to you about your health, maybe your fatigue gets better, kind of like a nice short counseling session. And then we did our counseling on telephone because we wanted to make it more accessible. And so you can see once a week for the first month of the study, and then every other week they would talk for no more than 15 minutes. That was the goal, with a registered dietitian. All right? And then after 3 months, we ended the study and saw whether or not they had improvements. So once again, we looked at fatigue using the brief fatigue inventory, and we looked at sleep using the PSCI, okay? So what was this diet? So the first thing I'm going to tell you, it's not revolutionary, actually, when we looked at it. It's a basically healthy diet, which is great, which means it's not very complicated. And also, to really emphasize, we did not want to change people's calories. That's what isocaloric means, keeping them the same. We already knew that if people could lose weight, they actually tended to have less fatigue. But to let you know, it's hard, right, to lose weight for a lot of people, even when they try really, really hard. And so we wanted to say, if you improve the quality, not just the quantity of your diet, do you get improvements in quality of life? Because these are things people can achieve far more easily than quantity. And we use daily food checklists, which I'll tell you some more about as we go on down the line. So as you see on the diet here, right, half of your grains are whole grains. And that doesn't mean a little sprinkling. That's 100% brown rice, 100% whole grain bread, etc. Okay? And then also we had them have at least 5 servings of vegetables. It had to be at least 1 leafy green, 1 tomato or tomato equivalent, I'll say, 1 orange or yellow, okay? And then we said you could choose it from other groups, right? And then you also had 2 servings of fruit, 1 high in vitamin C, and then 2 servings of fatty foods that were high in those omega-3 fatty acids. So they could have fatty fish, like salmon, for instance, or they could have nuts and seeds. So we'd emphasize walnuts, flax seeds, canola oil. Can I just say canola oil? One of the most underused oils that's the highest that is used as a cooking oil in general for omega-3s. This is what we had them do on a daily basis for 3 months. So just to give you an idea, the attention control people, they heard, using the same sort of counseling techniques as diet, to get diet to change, about these items. So example, oral health. I loved oral health. I wondered if people would actually want to talk for 15 minutes about these, by the way. That was part of our study. You may wonder that yourself. Turns out people really like to talk about these things for 15 minutes. They were perfectly fine. They said, this is good information. Thanks. So I'm going to just tell you what we found out. You can see here that you have the fatigue on the left, the general health curriculum on the right. And what you see is through time, you see the fatigue reduction diet went down significantly to normal levels of fatigue for both fatigue and sleep. And the general health curriculum essentially didn't change at all. So even talking to those great research assistants didn't count. So how would we bring these to the community? I said, there's a lot of people on Facebook who are cancer survivors. What if we could show people how to swap things in their diet for quality? So we've just begun to create a Facebook page. It's live. You can see the front cover of here, and our various URL there to be able to get to it. So if you're interested and you want to take a look, I'll just show you. We have a swap. This isn't our most famous one, by the way. We have a muffin swap. But this is for a cheeseburger. Your average cheeseburger that you'd get at any fast food place, all of those things there, you can swap for the same number of calories, right? But have the high omega-3s, that's rainbow trout. You have leafy greens. You have the orange yellow. You have the red. So you're getting the idea. You get a lot more that you get. And so we have various infograms that kind of show this. And then we'll have a recipe for like the Cajun rainbow trout. And I'm going to say that your cooking class that you're going to have later in the afternoon has wonderful recipes that look like they're going to fit into this just perfectly. So I just want to do a shout out for that. It'll be really great. And so you have that. And also, though we don't show it here, we give people little tips about the science too, about like how many people have fatigue. You know, how do you actually measure diet, for instance? And last but not least, if you give us your email on the page, it has a place for giving more information. You get tips, and this you get your daily checklist. So this is a really low-tech way to keep track of all those various foods. All you have to do is do a check mark in the box when you've had it. You can do this online if you want to be high-tech. If you want to be low-tech, you can put it on your refrigerator and just do it that way. With women being able to do this in the study, they hit their goals 75 to 80% of the time. So this is a really good, easy way. People have used it in other studies, like for the Mediterranean diet. So a nice way to keep track of your diet and to kind of learn it. Obviously, it takes a village to be able to do these studies. So I want to acknowledge all the wonderful cancer survivors I've worked with. They've been lovely. All my co-investigators and research assistants and my funders. And I want to just really end with a quick story about Connie. Connie was a breast cancer survivor who was in our acupressure study. She was a high-level exec before she actually got cancer. And she got cancer fatigue and brain fog, and essentially she couldn't work, right? She withdrew from many of her friends and really was feeling like she was a burden. She saw our study, she decided to get into it, she got involved, she did all the points, she was a very great participant, as many of them were, and now she's back, she's working, she's getting involved with her friends and family. She's one of our biggest advocates, and she's the one who gave me this title and wanted to tell all of you, please go out there, do help yourself, and get energized. Thank you for listening.